So for the rest of this week, I'm going to be talking about relief, pain relief. So in the last number of slides, I was bringing to mind all the different ways you could possibly be uncomfortable. From now on, for this week, I'm going to bring to mind all the ways that you can be comfortable. So I want to invite you to begin by just looking at the slide right in front of you. There's two words on it. One is pain, the other is relief. You can make a choice which one you focus on. And right now, I'm going to encourage you to take a couple of breaths and focus on the word relief. And just see what happens. Of course, you're aware of that other word on the page. But see if you can just focus on relief. And even maybe notice the soft, wet stones in this picture, the rocks. They're so smooth. And think about the word relief. And just one more breath, choosing to notice that there's two words on the page, but you're going to focus on relief. And that's what we're going to be focusing on. I talked about one form of pain relief, which is medication. Now I'm going to talk about many other ways that can bring you relief. This list in front of you is not even close to being exhaustive. There are many different movement and physical pain relievers. And I'm talking about right now some of the more common ones that people use. Movement is helpful for both pain and stress reduction, as well as your overall health. When we're uncomfortable, we tend to not want to move, and it's exactly what our body needs. What's important for you to discover is how your body wants to move and what helps you feel better. I'm giving you some examples of what people have used. These are well-known, well-researched, and tremendously helpful. Water is amazing. There is something that happens when your body is in water that allows release. Tremendous for both stress and pain reduction. Even if you can't swim, putting on one of those jackets that allows you to float around, letting your body relax in water. Water stretching, where you get to hold on to the side and just let the water help you, heal you. And physiotherapy, where you're actually working with a therapist in the water. It's a form of physical therapy. On land, yoga, tai chi, and qigong are also tremendously helpful, and there are often classes that you can find, at least for yoga for people living with MS, but you can also find Tai Chi or Qigong classes for people that are living with chronic illness. And those are wonderfully helpful for the immune system, but allows your body some increased movement. Stretching, or any type of exercise that increases strength and relaxation without increasing your symptoms. You know your body best. So you get to discover how you can move your body and help yourself get physically stronger and feel that sense of relaxation without irritating parts of your body. A good way to do that is to work with a physical therapist. Now, many people believe that physical therapy is if you are not able to move at all. And sometimes people don't get referred to physical therapists until they're pretty much almost in crisis. Physical therapy is wonderful at any point. This is a trainer, a person that has been trained to help you move your body in ways that will strengthen you. And most insurance companies will pay for this. Very underutilized resource. And as always, a good physical therapist is very important. A not so good physical therapist, of course, can frustrate you. So you can get some referrals through the MS Society. Then there's some non-movement physical interventions that can increase comfort and relaxation, like heat or cold. And often people don't think about this, but cold can bring down inflammation, or heat can soothe discomfort. And massages also can be wonderful. And it's important to remember that if you haven't exercised for a really long time, that it's probably not the best idea to just go out there and do it and go full on. Pace and consult a medical professional. And there have been some programs that are being run through the MS Society that help people kind of build up their ability to exercise. There's some Living Well programs, Free from Fall programs, so you can get guidance through the MS Society sometimes also. So just to review, we've talked about mind-body interventions before, but I want to talk about it just a little bit more because the intervention that I'm going to be showing you this week is a mind-body intervention. They're well researched, they're safe, and they're an effective complement to both medical and psychological interventions. And as we've already talked about, our mind and our body are connected, so we can learn to utilize our mind to help the body or utilize the body to help the mind. Now, in some of your other assignments, I was helping you utilize the body to help the mind. Relax your body so your mind can slow down. And I was in Thoughts That Hurt, Thoughts That Heal, we were looking at how to utilize the mind to help the body. And we'll talk about that more for pain relief. We can use our thoughts to relax or rejuvenate our body, as we've talked about before. And relaxing or rejuvenating our body can help us calm down or change our thoughts. So there really is an important interaction. So I want to review some mind-body pain relief. And we've talked about some of these before because these are also stress relief. But there's some new ones in here. Imagery we've talked about, and we'll be talking quite a bit about that in about a minute. There's something called psychoneuroimmunology. It's a long word. People shorten it to PNI. Be aware of this word, and it will come up again. We'll go much more in depth into psychoneuroimmunology as a way to help yourself. But basically, it is the study of the interaction between what we think and how we feel emotionally, the psychology, the neurological system, and the immunological system in our body. Psychoneuroimmunology. Some of these words are big and long, and we don't have to know them, but it's really good to know that this is being studied, the interaction between these systems. We've talked about cognitive behavioral psychotherapy. Mindfulness and mindfulness meditation. We'll be talking quite a bit about this in the next week and giving you some examples of it. And right now, when I was asking you to focus on the relief part of that slide, that was part of a little piece of mindfulness. Just breathing and allowing yourself to notice. Some of the compassionate observer exercise is in the realm of mindfulness, but we can go much deeper into that. There's hypnosis and self-hypnosis, and there's been a tremendous amount of research on hypnosis and self-hypnosis for pain relief. And basic deep breathing and relaxation techniques, like the original exercise I gave you with the tightening and the bracing, and sometimes when I've asked you to stop and just take a breath as my voice begins to slow down just a minute here. The deep breathing and relaxation. And you're going to see this again, exercise such as yoga or qigong. So exercise is wonderful for pain relief. Yoga and qigong is wonderful for pain relief, and it's both a physical intervention, but it is also a mind-body intervention, because people find that by doing yoga, especially a slower yoga or qigong, not only do they feel more flexible, have better balance, and this has been studied with people living with MS, but yoga and qigong help you to slow your mind. And you will have resources for all of these interventions in your resource list that's available to you on the sidebar.